Falls is the biggest indicator. And you know, in terms of how you're doing in Falls, there's a couple of homes, I believe, if I recall the statistics, are about the same as Ontario, and there are a few homes that are higher. So indicators don't mean that there's a problem, but it gives the council information you can ask the questions to assess, and staff to respond and be accountable for that. What other things, you know?
Sorry, let me interrupt, because you've touched on something that I'm interested in. I mean, in order to understand what the baseline data is, I'm curious whether at the start of your work, you looked at the baseline data, you looked at the quality indicators, percent restraints, percent falls, percent ulcers, percent antipsychotics, percent pain. I've got the list right here. So it would be useful to understand how the 4 homes in question compared to the rest of the province on those benchmarks, so that we can understand, are we dealing with actually 4 homes that are doing very well vis-a-vis the provincial average, or are there problems to begin with? Because 1 or 2 incidents doesn't necessarily tell us how we're doing across the range of indicators. So my question is, I assume you looked at that, and how are we doing on those 4 homes right now in a 2018 benchmark?
Yeah. I certainly did look at the quality indicators, and in terms of the quality indicators are followed, the highest risk is falls. So as I mentioned to you already, you're doing a few homes, and again, it's an indicator. It doesn't mean there's a problem. I wasn't able to drill, the mandate didn't allow me to drill down too far on that. But this is the information that should be coming to council, so you can ask the questions, understand what's the home's policy related to falls, what approach, you know, what are the reasons for the falls? You know, if you have, for example, and this is where comparing is very difficult, and it's very difficult to answer your question. If you have more residents who have dementia in your home than another home, the likelihood is your fall statistics are going to be higher. So this is part of the discussion about the statistic, and I haven't drilled down to that level to have that discussion. That's what I'm suggesting you do with the...
Well, I can ask staff that afterwards, so that's fine. I'll move on to my second question, which is, I remember when previous reports have come before this committee that we talked a little bit about the differences in the time, the personal time in not-for-profit homes versus for-profit. If memory serves, and I stand to be corrected, that on average, non-profit averages were considerably higher. So yes, so we had in certain cases different statistics for for-profit homes, and I don't remember what that delta was.
Okay, I can tell you the detail.
Okay, so if you answer that, then I'll tell you what my actual question is. Go ahead.
Generally, long-term care homes in general are around 3 hours of care a day right now, in general. The 2016 Ministry of Health Statistics, and they come from the staffing reports that are submitted by every long-term care home in Ontario. For the not-for-profit sector, it's about 3 hours, and for the for-profit sector, it's about 3.05. So there's slightly higher staffing on average in a for-profit home than a not-for-profit home, and the big driver of that is often salary, wage.
Right. And then in terms of their ratios, within that 3 hours between PSW and registered help, would they be similar across the two, from what you know?
Yes, and I have them right with me. I'm just going to find them. So the staffing ratios, I'm going from my memory here, and I'll find the page. For example, right now the City of Ottawa on a day shift have 1 personal support worker for every 9 residents. In other homes, it's 1 for every 7 to 8 residents on day shift. On the evening shift, I believe, if I recall correctly, the City of Ottawa homes have 1 to 21, whereas other homes have 1 person support worker for every 21 residents, whereas other homes may have a few less residents per personal support worker. Night shift is about the same.
Thank you. My third question is about your recommendation about the idea of the creation of a long-term care board of directors, and I think that's an interesting idea. And I say that because I think you're right, and I think you were polite in saying it, but I don't know that we're equipped around this table to get into the details of essentially how to run a health services organization. I mean, I'm certainly not. I won't speak to my colleagues, but for that reason, I think the idea of having people around the table who act as a functional board with at least a skill set that could complement that kind of oversight is instinctively, in my mind, very sensible. I guess the one thing, however, that would remain if council were to act on your recommendation is the budgets and the staff advice on the budgets would still be coming from staff who are employees of the corporation, correct? You're not suggesting that there would be independent staff supporting this board, are you?
No.
Yeah.
No. It would be the director of long-term care, I would believe, would be your key resource, but there would be other resources, and I mean, obviously the general manager provides that higher level of oversight.
Right, yeah, and I guess the hope would be that through a combination of different skills, you would get people around that board who would be able to ask the right questions to get at.
That's the point.
And in fairness to our staff, and one of the challenges with having a municipality run a long-term care facility is, of course, council has, over the last number of years, has instructed staff to come up with a draft budget that has certain financial restraints. And staff do their very best to come forward with recommendations as council directed them. But with that, of course, sometimes the risks associated with those are not obvious. They're not always obvious. And I remember in Budget 2017, some of the staff recommendations that came forward were actually closing some of those high-need beds that you spoke about. And here you are 18 months later saying we have to reconsider opening or expanding the number of high-need beds. So, just to say that in my experience, you're right that it's a difficult job for staff because constraints that we give them, and we're not always clear on what the risks associated with those are. So I simply wanted to say that I think this is something worth considering. And I think, a question that was clearly outside of the remit of your mandate is, are municipalities the right entities to be owning and operating health facilities? And I know that wasn't a question in your terms of reference, but I'm wondering, as a last question, whether you wanted to offer any thoughts on that.
Madam Chair, certainly I can offer that. Municipal city-run homes are an integral part of the long-term care system, and I see, personally, I see this as a responsibility that every city should seriously consider. Some have pulled out, definitely, but usually they pull out because it's a financial consideration, right? So, but the cities have offered long-term care for decades, have an excellent reputation. It's been sullied a bit because of the last year in the coverage media. It's a complex issue, and it's also it's a hard field to work in. You have to love it. You have to have passion for it because it is difficult. But I do believe cities have a role, and I do believe the non-for-profit sector has a role. The not-for-profit sector has shrunk compared to the for-profit sector. And I'm not making a comparison of one to the other, but I think that it's healthy to have a balance of for-profit and not-for-profit, and city or private balance.
That's interesting. Thank you very much for your comments. Thank you, Chair.
Thank you, Councillor Nisman. Councillor Brockington.
Thank you, Madam Chair. Thank you for your report today and your extensive review that took place over many months. Was it your decision today, or were you advised that you couldn't pre-release your report prior to today?
I had nothing to do with that. I provided my report, and that would be direct to Janice as a question.
I'll follow up with staff in a few minutes. Will you acknowledge that the adequate amount of time per resident may be different than the provincial average?
So repeat it again for me to understand.
Well, we have a provincial average that you've demonstrated for a number of staff, but an average is an average.
Right.
I'm trying to find out is what is the right amount of time per resident that exists per classification?
The discussion in Ontario at this time is that there should be movement towards 4 hours of care a day. There are many provincial reports that have reviewed this. One approximately 10 years ago was called the Sharkey Report, and that was the first identification of the need to move towards 4 hours. So this has been being discussed for the last decade, and there has been some movement, but I believe, from my understanding, the provincial budget this year has more funds for long care. I want to get to that actually in part of the question. Been receiving about 2% per year. Now, the city has not increased its staffing. One of my recommendations will be when funding is received from the ministry, 1% be put aside for staffing and 1% for other cost of living allowance increases. It's not going to cover it, I don't think. Your costs are still going to go up, but I think there needs to be a balance there. It's all about balance. And what's been happening is that the city has been using the funds from the province to deal with its financial issues also.
Thank you. I think it's just important for this committee to be aware that, like I said, a provincial average is simply an average. And really what we should be looking at is what is the adequate and right amount of time per resident.
Right. I do want to point out also, when I speak about reducing that from 6 to 4 special care dementia areas, it's simply because the experience is the amount of care, the hours of care are higher. Not much, but they are higher in secure dementia areas. So of 8 comparators, we looked at comparators, and I spoke to comparators, we received their nursing information. 7 of the 8 comparators had higher staffing levels in their secure dementia units. So if you're going to be offering, and you will continue to offer that, but you have to have the resources for that level of care or your risks start to increase significantly.
The ratio that you calculate, is it simply number of staff divided by residents gives us a ratio, or is this actual one-on-one time that a resident gets with a staff member?
Well, of course, it's an average, as you pointed out, so some residents require more than average and some residents require less. So every care plan is very driven by the care needs of the resident, right? And this is why the care plan is such an important document. And so there's no, you can't say this resident needs this many minutes per day and this that. It's more, it needs to be more flexible than that. And you know, another thing too, across Ontario, I'm going to go to the Ontario scene, physical functional decline units have less staffing, so because of the increase, you know, the majority of residents have dementia, then less staffing goes to physical functional decline. It's a constant balancing act, and it will always be.
My final question is just about training that PSWs get. Did you analyze, I'm not sure if this is a college program, is a diploma program in colleges, but did you analyze that specific training that they get from A to Z, identify any shortcomings? You identified what was missing within the Ottawa model, within the industry itself, but is there anything before they become employed that they're missing that perhaps we can then communicate on?
Well, a 6 to 8 month course means they're missing quite a bit. I mean, to care for people with dementia needs ongoing education and ongoing support. The question is, repeat your question again, sorry.
I was just asking if, even prior to becoming employed, whether their training package that they received had any deficiencies.
I get it. Okay, so training for personal support workers is provided by many different organizations. Algonquin College was one I visited, but they're private organizations, and they must meet ministry standards. So there are standards set, and as long as their curriculum meets those standards, and I assume, I don't know the detail of it, process to review that and so on. I think that there are private providers, colleges, a number of different situations. One of my recommendations is the city partner with one organizations and develop their own personal support worker certificate program to attract and recruit and then attract the best, attract the people that have compassion, that are suitable for this kind of care.
Great. Again, thank you for your review and your report today. Thank you.
Thank you.
Thank you, Councillor Brockington. Councillor Shirelli.
Thank you, Madam Chair. Okay, I have a few questions from basically all over the map of today, but I do want to say thank you for the report. It's very logical and factual, and it's not argumentative. So I think it's a big help to us. On the board, you're recommending you're recommending a combination of members of this committee and members of the public, correct?
Yes.
Okay. And you're specifically recommending that we have people who are subject matter experts?
Yes, in part, yes.
Okay.
That may not only be in long-term care.
Yeah.
Quality in broader sense is quality and risk could be a long-term care person, quality and risk, and some other, I'm not going to outline all of them, but yes.
Okay, because I know that when we set up a subject matter board before, it turned out that everyone we appointed was a lawyer. Okay. No, I know Mr. O'Connor sees nothing wrong with that. And Councillor Caudry assured me that the reason for that is that anyone who's been through law school thinks they know everything. But will you be able to make a strong kind of emphasis to council that that's what we have to be looking for in citizen members?
Yes, and I think that exactly the point is you need to discuss what skill set you need on that board in order for them to bring forward to this committee, because they will not have any power. They will not have any other than bringing recommendations as committee and then bring forward to council. So yeah. I think this committee has control of that. Okay.
Now at budget time, we were dealing with last year's spending and budgeted spending of last year. And it looked to some of us as if the budget was underrepresenting the need we were going to have this year. So I'm perfectly willing to make the changes we need to make in our spending to make these improvements and fixes to the system. But I do have to point out that last year we actually spent more than we budgeted for in long-term care. And could you just outline some of the things we spent that extra money on?
So the two areas that the one area I looked at the most was nursing and personal care. And out of the 14.5 million additional funding, 13 is nursing and personal care. So based on that, my assumption is that as situations arose where there was a need to add staff for urgent situations or whatever, that's what's driving. I can't say that specifically, but knowing that 13 of 14.5 million is for nursing, I also know at one home, the home where the design issues exist in the secure dementia area, I do know that there was added staff at the time that I went into the homes to deal with some of the urgent situation in that floor. So I suspect that's, staff would have to answer you, but just knowing the 13 million is nursing personal care, that's your overage.
Yeah, so it would be logical then to assume that we're going to need at least in the next year, which is what you're actually saying we do need. Actually, you're saying we need a bit more than that at 2.9.
Right.
Right. Okay, so I don't want to say I told you so, but instead I'll say let me remind you that a number of us at budget time pointed out that the budget did underrepresent what we were going to need to fix this problem. And I think all the people who voted against that budget are at this table today. And I think we made a pretty description of what we were going to need. The question of volunteers. I've noticed, and there have been a couple of studies showing that people now are far less likely to volunteer for things than previous generations of people in their 20s. And the flip side, people in their 50s, 60s, and 70s are more likely to volunteer. So have you contemplated how to, and this is, I'm talking about in career-oriented functions, have you put your mind to how we would do that targeting so that we could make it happen, even though some of the volunteer pool is drying up?
One of the things I need to point out, decrease in long-term care hours is just an indicator. Again, it doesn't mean the program has necessarily diminished. I mean, it's a trigger to look at it further, and a full study of it was not part of my mandate. However, and hours are not necessarily, some of the indicators are different than hours. They don't necessarily the best indicators, but I think that what I've seen, certainly in terms of the placement from schools into long-term care homes, there is a large group of young people that are still interested, even though your statistics would suggest it's not as much. There is a large pool of young people involved in long-term care, and so that's an area that I think there's still some recruitability. In terms of the 50, 60-year-olds, you're into my age range, and there's a lot of people out there with a lot of time, interest, and skills that are willing to volunteer. They just need to be directed as to where the need is.
Okay. And just on the issue of budgeting again, as a city, if we making cuts anywhere, we try not to cut frontline services, and there's very few things as frontline as dealing directly with patients in long-term care facilities. So really, it's a choice of whether you're funding it or not here, because would you agree there aren't enough administrators that you could cut them all and you're not going to solve anything?
So repeat your question again.
Well, the saving, if you're looking for savings, it's going to have to pay for this increase. It's going to have to be in other parts of the city operation, not in the long-term care area. Is that right?
Not necessarily.
Okay.
The long-term care home budget is 3 components, and the province funds the nursing and personal care and the program. The one area that the city or any long-term care home can take money and move up to the other envelopes, is if there's a need, is what's called the accommodation envelope. So that all the administrative services, human resources, housekeeping, laundry, nutrition, those type of services. Currently, the administrators aren't responsible for that budget, and there is money that you can find in that budget to fund some of your other pressures. So that's one of the recommendations I've made to take a look at, why you're not generating a surplus there. That's where for-profit homes, part of where for-profit homes take a profit. And that's where non-profit homes take that money that they can, their surplus, and apply it to areas of need. So there is some flexibility there. And the other side of the coin is not necessarily reducing costs, it's the area of revenues. Currently, you charge preferred accommodation revenues for private and private rooms. I don't recall the actual number, but it's significant. What happens with preferred accommodation revenues is homes use that for profit, for equipment, or for staff. So it's another area. The high wage transition fund, you receive a small amount for your additional high wage, but you don't receive a sufficient amount. So I think there's dialogue with the ministry on something like that. So I think it's both the cost side and the revenue side.
Okay, so we can get some of it from within this sector.
You can, yeah, I would suspect, but I did not study in detail the accommodation funding envelope.
Okay, so that would be a separate budget time exercise, I guess. Okay, thank you very much.
You're welcome.
Thank you very much, Councillor Schwelle. Councillor Kakish.
Thank you, Chair, and thanks for the presentation. I just had a quick question in terms of the recommendations that's before us, and in your presentation you spoke about obviously having the right quality people and right individuals with the skill set, with the attitude, the communication skills, all those things that you listed. And you know, when I look at the recommendation before us today about hiring the FTEs, obviously you pointed out to the ratio issue as we PSWs and the residents in the homes. Is there a benefit as well to perhaps providing some funding towards training instead of hiring them? Because what I see before us is we're throwing bodies at the problem. And you alluded to in your presentation some of your issues in terms of finding the right people as well. So is there a benefit to perhaps rewording or changing that to also set aside some of that money towards reteaching, if you will, or coaching some of the people that are there, or different things to do with that money, because I see that as also part of the problem as well.
Yeah. I did not review in detail the education budget, so I can't speak to that fully, but I do know generally education budgets are the place where outside of the city that you start to look at, can I take some of that money for something else? That being said, I do believe there's a lot of education provided in the city. It's a question of providing more and the continual support, and especially a focus on dementia. I think the biggest issue in front of the council is, and in front of long-term care homes, is how you're going to evolve the programs you provide service to people with dementia. Because it's the elephant.
And I've been to the Carlton Lodge in my area, and I know we have a great team of people there, and we were fortunate that there was very few or limited or zero incidents in that home, and I've seen what you ended your presentation on in terms of the great service that most residents receive on a day-to-day basis. And so I just want to make sure if we're going to be spending this money, we do that's effective. And based on your presentation and your report here, obviously, a big component is the FTEs, but I think there's more to it than that. And I'll ask that staff, but I was interested because you had a thorough, examination and interviews that you spent doing on this, if you feel that there might be more benefit of dividing the funds in a different way.
Yes, I didn't get that specific on education. I mean, obviously, I've mentioned education. One thing that in your comments that I'd like to raise, though, is and Carlton Lodge has excellent care, definitely, but I still heard it. People can say that there's good care or excellent care, but they can be really, really nervous about the potential for incidents, let me use that word, especially in the area of dementia care and resident-to-resident abuse. I mean, it's not the resident's fault, but it's a symptom, it's a behavior that's a result of their dementia. Yes, Carlton Lodge has excellent care and excellent services, but as with the other homes, I heard from families, and I heard from residents also about issues like staff attitude, equally at Carlton Lodge. So I think the important thing here is that the good thing is that the City of Ottawa has an excellent history of good reputation. And I think that well, in fact, I know from a lot of families that they've acknowledged that, but they still have concerns.
And so those infrastructure issues in the homes are all the homes are outdated, all of them could be redone. In those cases, I mean, what are other municipalities doing? Are we demolishing and building new ones, or are they retrofitting what's there to deal with the issues of internal incidents that may happen between residents?
So again, ask the question.
So you're talking about how the infrastructure of these buildings, of these facilities is outdated, yeah. and in new builds, they would be done differently to avoid any kind of incidents between residents, correct? Is that what you were saying?
Well, I didn't say the latter. It's very hard to say you avoid any incidents.
Sorry, not prevent, but it would lower, I guess, the number of incidents that perhaps would happen.
Yes.
And so can that be done with a facility, say, like the Carlton Lodge, where you would change the layout of it, or are we talking about new builds and completely different?
I did part of my mandate at all, so I didn't talk about builds or construction or anything like that. Of the 4 homes, I believe there's some homes that could have changes to their design. with the approval of a budget. Other homes is going to be very, very difficult to change some of the design. Carlton Lodge, for example, there is a very, very large dining area for residents, and it's super, and it works well. As more and more people have dementia, and at Carlton Lodge, 87% of residents have dementia. That is going to be more and more difficult to provide care. You know, people in a dining room that have dementia, they're getting up, they're walking over, they're taking something. You know, there's a lot of things that have to be managed. So that kind of design would have to be looked at. Because it's an open space, probably can be retrofitted. On the residential home areas of Carlton Lodge, the dining rooms are very small. So for the physical functional decline units, where there's a lot of very large pieces of equipment, the people, mobility equipment and so on, there are challenges to provide good dining for a physical functional decline in those small dining rooms. That also could be, there are other spaces that possibly could be, you know, switched for dining, and there's a cost to all of it. Some can be done and some would be too expensive, and probably you'd have to look at whether you're going to rebuild. Okay. But that's not, I don't think that's not the mandate. Not, I think, an item that you have to concern yourself about today.
No, I appreciate that, and I was outside of your scope, but since we have you here, I thought I'd get your thoughts on that as well. So thank you for the presentation, and thanks, Chair.
Thank you very much, Councillor Kakish. Councillor DeRose.
Thank you, Madam Chair. This is a very good presentation. Thank you very much, Mr. Fougere. But when you compare our city facilities operating on the long term, have you compared them with private and non-profit and non-profit, or you just did the review based on the needs of the home?
During the first, for the staffing issues, it was the whole province, and it was 2016 Ministry of Health and Long-Term Care data. So that's where that comes from. We completed a survey of 8 comparator homes. We used criteria for those comparator homes, like size and so on, and there were comparator homes in Ottawa and there were comparator homes in other parts of Ontario in that. So we used that data, and what that actually showed was the staffing levels are about what they were in 2016. It led me to believe that there hasn't been a lot of movement in the province of Ontario between 2016 and 2017. So I think if you level the playing field and bring your staffing up to level, you're then where other long-term care homes are, and hopefully, and I think the light has been on this issue, that long-term care will start to move to the 4 hours of care a day.
Thank you. In your review, have you did you added a review of the managerial overhead, or it was just totally on the service side of it? PWS.
I did not review the managerial overhead, but from intuitively the management structure, I can't imagine that it's any different than a lot of similar structures. It's in line.
Okay. In comparing to our regular or non-profit, our managerial, so you think we have also we have similar staffing at the same level
as other non-for-profit homes? Yes, pretty well, I would say. I mean, you know, you have to adjust by size and a number of different factors, but I would say pretty well.
Thank you. Thank you, Madam Chair.
Thank you very much, Councillor DeRose. Are there any other questions for Mr. Fougere? Seeing none, Mr. Fougere, just wanted to take this opportunity to thank you. You've painted, I think, for all of us, a very vivid picture of the challenges that we face in our long-term care homes, addressing the complex needs of our most vulnerable citizens. And I think you have given us a lot of great advice on a path forward to make sure that we continuous improvement. So we are grateful for all of your hard work over the last 6 months. Thank you very much.
You're welcome. Thank you.
Okay, Ms. Burrell, you wanted to, I think, respond at this point, so over to you.
Thank you, Madam Chair. So as I pointed out earlier, there was 2 documents that you had received. One was the slide deck from Mr. Fougere, as well as the transmittal report. So at this point, we just have a handful of slides that we would like to walk through with committee, provide some context. So just in terms of the last, sorry, I have double duty here. Okay. So just to run through what's transpired in the last 11 months. So in the same, thanks. Okay, thank you. Council was apprised that an incident had occurred in one of the homes, and we outlined all the steps that we were undertaking at the time. In July of 2017, we received a director's order related to 3 homes. So that led to the development of 5 very comprehensive plans, and we began implementation immediately on some of those actions. That update was provided to stakeholders and councillors along with all of the compliance plans. The majority of those actions were all completed by between September and December 2017. And following that work, the ministry completed its inspections, and we were back in compliance by the end of January 2018. Then in 2017, we rolled out a very broad stakeholder engagement session and surveys. Over 956 people comprised of families, volunteers, and staff either attended in-person sessions or completed a survey. And if you recall, in September of last year, we also came to CPS and provided an extensive, comprehensive 44-slide presentation on long-term care. As a result of an incident of verbal abuse at the home in the fall of 2017, the mayor requested that third-party review. And I mentioned earlier, we've been working closely with Mr. Fougere since that time. So, and by January, we had reviewed all of the feedback that we had received from the stakeholder engagements. We developed a comprehensive work plan. Once again, we communicated with council as well as all of stakeholders in terms of what the work plan was going forward. And then the last 2 are the fact that we have that the Auditor General, who tabled 2 audits this morning that totaled 28 recommendations from those 2 reviews. So what we decided to do was consolidate them into one comprehensive work plan, and at the back of your transmittal report, you have that work plan. Next slide. Yeah. So I have highlighted the various reviews of feedback to reassure committee and stakeholders that we are actively listening and we are responding to all the concerns that have been raised. We commit to completing all the actions that have been noted to date. We all commit to a culture of continuous improvement and communication. Given the multiple sources and recommendations, as we said, we've consolidated them into one work plan. So now, at this point, we have 84 items in that consolidated work plan, 18 of which are complete, 21, and 43 are in progress for a total of 41%. And we've broken them down into 5 categories: staffing, quality improvement, infrastructure, communication, resident care, and service delivery. So at this point, I'll just ask Dean to highlight some of the actions that have been completed.
Thank you, Janice. Madam Chair, in terms of staffing, we are going to continue the in-person training related face-to-face around abuse and the prevention of abuse in the homes. We're also in June going to be doing a abuse awareness week in all of the homes, which will include education for our staff, families and residents and volunteers. We have developed tools around the culturally diverse background of our residents, and those are up and running and being used. Things like picture boards, where a resident who may not be able to communicate can still point to the picture board when they're asking for specific care or services. The dementia training that was highlighted in Greg's report around staff and around education of families, we're going to be training 4 staff members on gentle persuasive approach who will be certified and able to do education for our staff as well as our families. In terms of the on-call manager that was highlighted this morning in the audit report, we are developing training for our managers on intake of incidents that occur in the homes to ensure that we have the proper information to meet the legislative requirement around reporting. As Greg has highlighted, we are going to prepare, look at our staffing ratios and identify the best use of any new positions that are developed to ensure the safety and care of our residents. We are also developing new tools around the screening of staff for suitability and language skills. That will include written testing on the interview as well as oral communications. In terms of employee recognition, we understand, and you heard clearly today, that our staff have been through a very rough ride the last little while, and we're looking at opportunities through consultation with staff on how we recognize them for the work they do, and also how families and residents can be recognizing staff. In addition to that, we're going to develop a peer support network to help staff in the workplace, and also to look at education around mental health and supporting our staff in the homes. In terms of quality improvement, as we heard earlier today as well, there'll be an extensive review of our medication practices across the homes. The 17 audit recommendations around medication will be implemented